Okay, so Dr. Jim MacKenzie grew up and went to college in Minnesota. He decided to attend his dad's medical school in Kansas City and did an inner city Detroit immersion program for his 3rd and 4th year clinical rotations. He completed his adult psychiatry residency at Loyola University Medical Center. He left Loyola to do a child and adolescent fellowship at Northwestern and applied his interest in hospital and ED consults into pediatrics. He ended up joining staff at Northwestern after graduating from the fellowship program. He learned there are only a handful of child psychiatrists in the country who do full-time consult work, so he settled into the role as Director of Emergency Service and Consult Liaison Service. He then worked at Rush as the Director of Pediatric Collaborative Care before leaving academic medicine for private pediatric psychiatry collaborative care with Illinois PCPs. He has formerly served as the president of the Illinois Psychiatric Society and is active in political advocacy at the state level. He is also a counselor with the Chicago Medical Society and member of the Illinois Medical Society Government Affairs Committee. This year, he was honored with the Psychiatrist of the Year by the Illinois Psychiatric Society. So congrats on that.
What a nerd. What a nerd. This guy needs to do more stuff for fun, I think, you know. Hey, thank you so much, Marissa, and I really appreciate it. I'm honored. Hey, everybody, it's good. I can see all your faces on the Zoom screen. 1, 2, 3, 4, 5 by 1, 2, 3, 4, 5. I can do that kind of math. 25 of us. That's pretty cool. So thank you all for sticking around and tuning in. And I hope that I can connect with you virtually as well as we can in person. I am honored to do that. I like to do this every year. It breaks my heart that we're not physically together, but that's okay. We can meet up again later on. If you remember one thing from just hearing me blab for a little bit is I am you. You are me. And I don't mean in some weird metaphysical, I'm not trying to be poetic with that. I just want you to know that I truly, truly remember what it feels like to be a medical student. I mean, time goes so fast, yet so slow, yet so fast that I remember being, a medical student like it was yesterday, but my God, it's been 20 years ago and I don't feel any different. And I never obtained that feeling of, oh, now I know what's going on. You know that feeling that you have right now as medical students? You're like, how many more damn algorithms and how many more lists do I need to memorize? And I guess magically someday when I'm done, all this isn't scary anymore. Nah, it's still scary. You still feel like that. Just other people won't be that honest with you to tell you that. And you don't want to lose that feeling, that trepidation that, hey, I wonder if I'm right. That's what gets you to look something up. And that you are a very, very safe person. As physicians, our goal is always safety. It's not curing the problem. It's not how fast Mr. Smith or Mrs. Smith gets better and recover. It's first do no harm. And the longer you practice medicine, the more you realize how important that is. It's so much better to have a patient that doesn't get better than it is to mess something up and to have your milligrams in the wrong place or something like that. But that feeling in your heart, if you have what I had as a medical student, mine was so bad. I didn't even want my mom and dad to tell people I was in med school because I didn't want anybody to wonder, why didn't I graduate? Like, you know what I mean? Like if I had to go work as a forklift operator somewhere else, I didn't want them to, hey, weren't you in med school? Like, no, I was doing the forklift, because I think I'd be really happy being a forklift operator too. Like there's so many things I think I could do, but I don't know if any of you felt like that. They talk about the imposter syndrome. Forget about it. I didn't think I was even going to finish, just so you guys know. Okay. And my friends that I was in med school with that felt like me, you heard that list of nerdy kind of bullshit stuff that I've done. Most of that's volunteer. I just showed up and they give you an award because you're the only one there, but it's generally people that felt like me that were wondering, am I even going to graduate? Am I going to ever get this right? Am I going to be the first person that delivers a baby and the kid bursts into flames because I did something wrong? Like, I was so scared the entire time as a medical student that now I look back on that and I realize, no, that was okay. And a lot of people feel like that and they just don't talk about it. Do they still use the word gunners? Do they still have that word? Oh my, what's with those people? And it was always like their mom invented aspirin You know, and their dad, your dad, he was the first recipient of a heart transplant. And while it was happening, he did an eyeball surgery. Like, those are the people that you're competing with, you know? And my aunt invented the Band-Aid, and I volunteer with Mother Teresa in the summer. That's what, those are the loudest people. It's the quiet people that are just trying to graduate, trying to get through, that kind of question their being. I'm talking to you. If that's you, you belong. And you're going to be the safest, best doctor in the world, right? Now, what are we talking about today? That we're talking about political stuff, and it overlaps. Nobody shows up to political stuff. You guys, I should not have been the president of the psychiatrists in Illinois back in 2014, 2015. I shouldn't have been that guy. I'm still in my 40s. Like, think how many think how many people live in Illinois, 12 million. Think how many doctors, think how many psychiatrists there are. Why was I the psychiatrist that ran the Illinois Psychiatric Society? Because I showed up. I was going. At times I was the youngest person in the room at some of those meetings, right? But I kept showing up because I cared. I thought it was cool. Do you get paid for that stuff? Not a cent. You lose money. You pay for a membership to belong. So it kind of has cool titles and it sounds good, but you need the title so that when you're talking to a senator and you're being introduced, oh, it's Jim MacKenzie, the president of the Illinois Psychiatric. That's why you need those titles. So amongst us, they're kind of embarrassing and they sound silly because one psychiatrist knows to another psychiatrist. That just means you went to the last meeting, pal. But if you get interviewed on the news or if you're doing something, those titles, they carry a little bit more weight, right? So, but I just want you guys to know a lot of the stuff that I've done is just because I was the only one in the room. And I'm 49. So when I was your age, if you belonged like to the American Medical Association, which is a nice thing to do, you automatically belong to your state medical society and then your county or city. But now things have been all broken up, and I'm not sure I like the fact that they're broken up. So you can belong to your city, but not your state, and you can belong to the national, but not your region. There's all sorts of ways. Just belong to something so that you can be involved in medicine, because it shouldn't be left to me. Everything about me is strategically wrong in 2021 to carry the torch for psychiatry right now. I was doing a lot of work even in the last couple of years. Strategically, this is not who should be talking about what we need right now in society. I'm okay to sit down for a while. Straight white men, we had a good run for a long time. We're not necessarily what people need right this moment, right? So I'm also 49. I'm right at that weird, I'm not young, I'm not old, I'm just weird. I'm not cool anymore. I'm not the cutting edge cool guys. You guys are. You, by the way, I'm using guys as just a non-gender, just a people thing. You, the people I'm talking to right now are the people that need to be standing up, talking to legislators, no longer me. Because when I go, it's me and 4 or 5 people of at least 2 or 3 minorities. It turns into a civil rights issue rather than a patient safety issue. So that's really a bold thing for me to tell you, but I'm telling you that straight. Just, I want you to hear that loud and clear. People like me are no longer, I'm irrelevant. It doesn't work anymore, right? I can't do it anymore. And the people above me, seniority, they all look just like me. So, and when I go to the state capitol and we have an issue, my opponents look the opposite of me in every way. And that's got nothing to do with the substance at all. But have you heard about mid-levels, and they call it the right to prescribe? It's no longer prescribing privileges. This is being turned into civil rights sort of stuff. And the more you put straight white men in a business suit when you go to the Capitol, you stand out and you look like it just doesn't look right anymore currently. Maybe things will change and everybody's going to come back. But right now, I need help. I need help big time. And I need help from young people, because and I don't mean young, inexperienced. I mean young, fresh minds, energetic minds. This is your world, man. This is for you guys. So I don't think for a second that you shouldn't be helping out. And by the way, am I preaching to the choir? Hell yeah. I'm talking to 24 people that are spending their Saturday doing this. I know I'm preaching to the choir, and I hate preaching to the choir because when I'm in the choir, I hate being preached at, but I want you guys to know you are the current rock stars. And I'm that old, the agent that showed up, with the limo saying, hey, come here, I got to talk to you. I'd like to make a record deal with you. You're hot right now. You guys are exactly who needs to be involved in the safety of medicine. Again, it's all safety. None of this is about money. I think that goes without saying. I don't even need to tell you, because going to be a physician for money is the stupidest financial move anybody can ever make. Is you start out 300 grand in the hole. Like, that's the dumbest thing ever. You know that, I know that. Society doesn't understand that. Society thinks all of us make millions and millions of dollars. They do, honest to God. So we need to keep this always about safety. And right now, medical students, you're the living physical embodiment of the education that we go through. So if I go to the state capitol to work on a bill, work on something with some of my friends that are legislators, and I bring people my age and older, it's information, it's kind of interesting. If I bring you, if you're standing with me and I say, Bill or Susie or Joe or Skylar is currently in medical school, and you're standing there with me, and then I've got a resident with me and a fellow with me, and this carries a lot of weight, because you can't just gloss over the amount of years that we spend categoric decision-making that's being drilled into our heads, right? So you are hot commodity right now. Don't think you should just let somebody else do it, because there's been times now, you guys, where I feel like I'm just losing the traction on this, and I'm like, oh my God. And I keep going, I keep trying, I keep doing stuff, right? And we're holding on for dear life, but it's getting harder, because at 49, I'm now becoming one of the old people. I'm just not sexy. That's what I'm trying to say. And I mean that in the marketing way, in the pure strategy. I'm hitting you straight with this, right? I could dance around it. I made some notes. I thought about how I could say that in a more roundabout, more intelligent, emotionally intelligent way. But I just want you to know, strategically, passionate medical students mean a lot more to legislators than me at this point. I can't not put on a business suit if I go to the state capitol, right? Of course I have to get a haircut. Of course I have to put on my collared suit. And then I'm standing there in a business suit. Here's me. That's not what we want right now. Me talking about medicine. We want you. We want you talking about why you would sign up for something that takes 20 years of education for you to make about what a high school principal makes, maybe a little more, So I just want to start with that. You being with me right now on a Saturday tells me something about you. It's something about you that your friends might not understand and that your family might not get, right? It's not like medical student didn't give you a lot you could be doing right now, So hey, for the people on the call right now, I've been all over the Midwest, though, honest to God. Born in Detroit, grew up in Minnesota. I'm a DO, by the way. I went to my dad's school in Kansas City. It's probably the only way I even got in, to be honest with you. I'm aware of that. My dad was the first DO ever to work at Mayo Clinic on staff. So they had a big, picture of him because they thought that was kind of cool. And I'm like, oh, well, hi, hi. So that is probably how I got to be a physician. But I mentioned my dad because I want you guys to know my dad's an anesthesiologist. And forgive me if some of you have heard this story before, but when I was a medical student in the year 2000, my dad became the president of the American Society of Anesthesiologists. Again, that's unpaid. I was a med student going to the hospitals to start my rotations, and my dad was the head of the anesthesiologists in the country. And he's a DO. So I'd go to these little DO hospitals around Detroit, and people would see me and say, "Hey, are you MacKenzie's kid?" And I'm thinking, "Well, I'm MacKenzie." "Oh, you're going to be an anesthesiologist?" And I didn't even have time to get the words out of my mouth that I want to be a psychiatrist. I felt embarrassed to say I wanted to be a psychiatrist because my dad was at the time. By the way, did you guys know, President Bill Clinton, who was the president, Do you know what his mom does? Or well, she passed away, so I'm being very. I'm not trying to make fun of or point fun or be a jerk to anybody in heaven. But his mom was an advanced practice nurse, and asked her son, and every son loves their mother. And if your son happens to be the most powerful human being on the planet, that's a pretty powerful mom. And the mom in the year 2000 asked her son, the sitting president of the United States, honey, you love your mom, right? I don't know if I wasn't there. This is how I've got the story of my brain, you guys. Honey, president, son of mine, you love your mother, right? Your mom's a good person, right? Yes, mother. Honey, can you make a law that says nurses and physicians are equivalent? Well, Mom, I don't know about that. I'm an attorney. I don't know anything about medicine. Trust me, my son. Nurses and physicians are the same. For anesthesiology, we can do everything they can do. Take that pen of yours, just sign this little form, and we'll just call every nurse anesthetist an anesthesiologist and move on. That's the year 2000. I'm a med student. My dad's the head of the anesthesiologist. My dad goes to the White House, and he had to fight with Bill Clinton to not listen to Bill Clinton's mother. I'm a med student. I would go listen to my dad talk, and I'd said, Dad, this is pretty scary, huh? Because now I'm a med student, I got to intubate, and I'm like freaked out, and I'm thinking, this is terrifying. Dad, where are the radiologists, the dermatologists, the rheumatologists, the pediatricians, the ER docs, the psychiatrists, and neurologists? Why is everybody letting you do this by yourself? And he said, nobody thinks this could possibly happen. Nobody thinks flight attendants should fly a plane. That's such an absurd thought that people wouldn't get, the pilot union wouldn't even fight that. But if you don't fight it, the flight attendants are flying 747s because laws pass by people that don't know anything about airlines. They don't know anything about it. Medicine, laws pass because legislators don't take any science classes in college, some of them. The majority of them are attorneys, like Bill Clinton. So he had no medical training. He didn't know what an anesthesiologist was or a nurse anesthetist was, right? So it came really, really, really close. And that was 20 years ago. And that was the first time like a scope issue happened where physicians were almost the equivalent of people that didn't go to medical school, right? Now, my dad trained nurse anesthetists at Mayo Clinic. He worked with them. There was 4 of them, and then he'd supervise. So he was part of a training program. He has nothing against them. He works extremely close with them. And they used to babysit me as a kid growing up, So to be clear, he has nothing against him. He just would make the point, you don't replace the categoric training of 20 plus years of a physician to the technical skills of a nurse. All right, I become the head of the psychiatrists in Illinois in 2014. Guess what happened? The psychologists in Illinois said, we're doctors. We can write a course for ourselves and we'll give ourselves DEA numbers because we're doctors. And I said, hey, we got to stop this. Where are the pediatricians, the ER docs, the internal medicine? Anesthesiologists were nice to us because they said, oh yeah, we had this happen once. Here's what you got to do. And I'm like, yeah, I'm familiar. Do you know what I did? I brought medical students with me. And we went down to the state capitol and we were able to put the kibosh on the original bill, which was they would train themselves how to do it. Now, at the time, I was running a consult service at the Children's Hospital, me and 6 psychologists. I've got nothing against them. They're extremely smart people that don't know enough to be scared of what they were getting themselves into. And the general public, you guys know this, if you say the word doctor, the general public assumes you're talking about a medical doctor or a physician. Usually, if you're in college and you're taking a class on volcanoes and your professor, Dr. Smith, is talking, people understand probably Dr. Smith is a volcanologist, but not everybody. We're walking a thin line of transparency with this doctor issue. The American Medical Association has brought up this question of maybe we should drop the term doctor, which should be a salutation. Don't put that on your business cards or on your name tag or on your door. That's what our friends who are extremely nice people, the chiropractors, do that, right? They're wonderful people. I got nothing against them. They're great business people, and I do think they help people. But a lot of the general public thinks the word doctor means physician always, right? So heads up on that. But I want it to be clear. I've got no problem working with psychologists. They're brilliant. They're great at all their testing and the therapy they do, and they're really, really good people, but they're descriptive learners, and we're categoric learners. That's why you feel scared every freaking day in med school, because as soon as you feel the slightest bit comfortable with the topic, we change it on you. All right, you figured out, you got all that, you figured out the bone. Okay, here's the heart. You learn everything about the damn heart. And oh, you'll be on a rotation with the cardiologist. And they might ask you a question. Well, how the hell am I going to know enough about the heart to be with a cardiologist? I just got done delivering babies a month ago. That feeling, that's called categoric decision making. That's why when you have to give a differential diagnosis, you learn how in your brain to make a list of things. That's what separates physicians from technical people. Technical people are brilliant. They're not dumb. I got nothing against them. But categoric decision making is how you're able to handle crisis, right? So anyhow, I want to make that clear. Really, I want to underline that, because I'm sure you all feel like me. I have nothing against therapists. I love them. They're wonderful people and they're great at therapy. I love working with psychologists. They're wonderful people. Illinois, we had a real jam in 2014 when the psychologist said, we will teach ourselves how to do this for the DEA number. We're like, well, wait. So they don't, and I was the president, and I basically changed the bill to, they had to become PAs, because PAs already exist. So the psychologist put it on the front pages, and it was all this news, and maybe you've heard of it and you've thought to yourself, why do I even want to be a psychiatrist now? Because in Illinois, the psychologist said, well, we can do it. Yeah, but you basically have to become a PA. And so you could also word that like, the butcher at Whole Foods can prescribe medicine too. And that's true if the butcher at Whole Foods also becomes a PA. A bus driver can prescribe food, can prescribe meds if they become a PA. See what I'm saying? So we just didn't call it a PA. So now they have a new bill going right now. They're trying again. And their biggest fan is a state senator in Illinois who's extremely powerful. So this is nonstop, right? But it often comes down to me, and that's not going to work anymore. I'm wrong. I'm not strategically who to put in there anymore. I one time brought a very, very nice medical student with me to the state capitol. I was trying to meet a bunch of state representatives, and I couldn't get in. And all of a sudden, a staffer ran down the hall and grabbed a medical student with me, who's now a pediatrician at Northwestern at Lurie's, Dr. Price. And the staffer said, Representative David Leach would like to talk to you. And this medical student looked at me with fear in her eyes and said, what do I do? I said, go talk to him. It's why we're here. She goes, what do I say? I said, go tell him everything we've been working on. We go meet the nicest Southern Illinois grandfather kind of a guy who said to her, you remind me of my granddaughter. Why are you here? And she did one of the best jobs I've ever heard of lobbying about patient safety. And he said, so are you becoming a psychiatrist? She said, no, I'm going to be a pediatrician. And that moment was incredible, because it let the state representative understand this is a physician-patient safety issue. It's not something about money. It's not psychiatrists trying to, protect our turf. We could take, I don't know, 2 million psychiatrists and put them all on the same block, and we're going to have more patients than we can deal with. It's not that. But anyhow, so just know that you belong, and that we need you now more than ever. And it's I gave a talk with the American Academy of Child Psychiatry last year about how being an active an advocate, really, being involved in politics is a good way to counteract the feeling of burnout that we all get in medicine, because it lets you do something else to protect people. You can spend, 1 day in clinic and see 10 people, or you can go to the state capitol for a day and talk to 10 legislators and make a law or stop a law from happening that affects every single person in the state in the same amount of time. You can treat 8 people, or you can stop a law that affects 12 million people. And it's a good feeling. It's a good feeling. So do I consider myself some type of an expert? No, not at all. Not at all. I just go down there. Do I screw it up sometimes? Hell yeah. I probably screw it up more often than I even realize, And it's hard. You stay politically correct. One time I said poor instead of underserved when I was testifying once at the Senate, and somebody told me later, like, you dummy. And I'm like, well, hey, sorry, I took a day off of work, drove down here and spent the day and did it. And I said poor instead of underserved. Got a little nervous talking to the Senate. Sorry, so, you screw up, you stutter, you say something wrong. One time I said the governor was somebody, I said the Governor Rauner when it was Pritzker, little dumb things like that we all do. So don't think for 1 second that this nerdy guy, I'm trying to tell you that I've got it all figured out and I do it. I want you to know that I've had no training in this, and I've testified 3 times now at the Senate and at the House for stuff. I didn't author the law, but I helped pass a law. And Illinois, there's similar legislation in other states, but Illinois, we're the first state in the country to have a law that passed a year ago that public aid and private insurance both need to reimburse primary care physicians for working with psychiatrists in a formal collaborative care model. And that's all about access of care and stigma. So, by the way, side note, for those of you that are polite and you're thinking, I'm interested in mental health, but I don't know if I want to be a psychiatrist. Hey, that's even better. Get a hold of me. I want to know you. One of my challenges, there's 50 child psychiatrists in Chicago, about 250 of us in Illinois. Why? Medical students that like kids go into pediatrics. Duh. Why wouldn't you? My challenge is, oh, hey, Susie, the med student, I hear you like working with kids. Yes, I do, Dr. Jim. Great. I want you to become an adult psychiatrist. The hell for? Oh, so you can become a child psychiatrist later and help me with autism. Like, can't I do that through pediatrics? Yes, you can. So if anybody's debating, hey, I like mental health, but I'm thinking about being a surgeon or an ER doc, guess what? You're going to see a ton of psychiatry there too. And you can always be a psychologically minded, whatever you want to do, right? So, by the way, I mentioned my dad. I've had the funniest stories, with my dad. My dad made my life hell because he didn't say to me, I want you to become an anesthesiologist. I wish he had, because then I could have done this. No, I'm going to be a psychiatrist, man. I'm going to blaze my own trail. But he goes, sounds good. Like, no, you have to argue with me so that I can feel the power of saying, no, I'm going to do this. And he said, no, that's great. So I had to invent my own closure to that. I said, Dad, I'm going to treat pain. That was a cool thing. Jim and Akshay, you guys have probably heard this before when we talked. When I was a 3rd-year medical student, when I was in Detroit in a hospital, about 2 or 3 in the morning, this is when I knew for sure I wanted to be a psychiatrist. This little kid was brought in maybe about 9 or 10 o'clock that night. And now it's 2 or 3 in the morning, and you have that brain dead feeling where you're kind of like, and you're just like, you're thinking expansively because you're so freaking tired, and you're like, you just have these weird thoughts. And the ER staff was waiting for the X-ray to be read for his foot, whatever had happened to this kid on the playground or whatever somewhere. And finally, the X-rays came back, and everybody was so happy because they could put on a cast. And all the gunners, you know how excited the gunners are about orthopedics. Man, they were coming I feel like they were taking cabs from other hospitals to come in to put on the plaster cast to get a letter of recommendation to be an orthopedic surgeon, And the whole ER shifted over to the room where this little kid was. And on the other side of the ER, the police in Detroit had brought in a lady who was catatonic. You guys know what catatonia looks like? And you get frozen and you're like a statue. By the way, when I was in med school, I was taking an exam and I was answering a question about narcolepsy, and they talked about catalepsy on the exam. I was such a bad student that I would learn stuff during exams. You ever have that happen when you're like, hey, they're asking about catalepsy. Wow, that sounds a lot like cataplexy. I guess they're 2 different things. Or I'm sorry, they were talking about cataplexy. Did you guys know that? I learned that on the exam while I was taking it. I looked back to question 10. They're talking about catalepsy, and question 25, they're talking about cataplexy. I'm like, 2 different things. I guess I didn't know. Cataplexy is when you plop on the ground because it's one of the tetrad for narcolepsy. Cataplexy with a P, plop, cataplop on the ground, cataplexy. Catalepsy with an L, lepsy, that's your arm. That L is your arm stuck, like waxy. And people with severe psychotic disorders have that. Well, this lady was brought into the ER with catalepsy, not plexy, and she still was holding where the gun would have been. Like this. She's sitting in the ER like this. And the cops had taken the gun out, and they're like, we better take her to the hospital. They put her in the ER. And everybody was so relieved so they could go put the cast on the kid, because that was like the socially acceptable, I know what to do with my hands kind of a feeling. And nobody wanted to talk to the lady that was stuck like this and kind of frozen. Granted, I don't know how you talk to a cataleptic person, but I learned as a psychiatry resident how you do that. And you give them a benzodiazepine and they talk and blah, but they start screaming. Be careful when you unlock that. What's underneath you, you're going to see it. But anyhow, what hit me like a ton of bricks was after the cast was put on that kid's foot. And other than my friends that are on the call that have heard this story before, what's the first thing the ER staff did when the cast was dry? What does our society tell us that you do with a cast? And everybody's muted. I love it. Some brave freaking medical student, unmute yourself and tell me, what do you do when there's a cast? This isn't a trick question. What do you do?
Sign it.
Yeah, who said that? I couldn't.
This is me, Travis.
Oh, hey, Travis. I'm sorry. You're on my second row all the way to the other side. Good man, Travis. Thank you for answering, by the way. You're 100% right. In the United States society, if we see someone with a somatic bodily injury, that is so okay. Our society is so cool with your body being broken. We will put our effing name on your injury. What is more supportive than, what is more intimate than a stranger writing their name directly on a broken body part? And it took 2:33 in the morning of a med student in a haze to think to myself, and I'm not like a poetic kind of a metaphysical guy. I promise you, I'm a beer drinking, frozen pizza. That's me. So but for this to hit me meant it was really profound. And it was, the entire ER had to sign it. And I thought to myself, hey, it's a good thing we all like different stuff, right? It's a good thing that 99% of the people in this ER want to help that kid with his foot, because that's great, because I could have a hurt foot someday. But God forbid you're the lady that wanted to blow her brains out tonight, because nobody's talking to her still. They were waiting for a psychiatrist to drive in or something like that, by the way. And I look back on it. I was a third-year med student. I was still trying to figure out, I don't know what the hell I was trying to figure out. I was trying to figure out what the freaking Lupa Henley or whatever the hell that was. Like, I was terrified, so I didn't know what to do yet. But it did hit me that who was in more pain? The kid sitting there giggling, getting all the signatures. That kid didn't hurt at all. That kid probably went to school the next day feeling great. Probably had a party. The other lady, hopefully she didn't kill herself, right? Who hurts more? If you think about that, mental health hurts so bad that the son of the president of the American Society of Anesthesiology went into psychiatry that year. And when my dad was finishing, by the way, you can tell I'm really proud of my dad, obviously. I mean, I love the guy, raised my dad, but you don't get paid to do that job that he's doing. So I'm not like talking him up like he was like the CEO of like, FedEx or something. It was a volunteer job. It was just cool to watch him do this. But when you're the head of something like that, when your term is done, they have a national convention and they pass the gavel to the next person. And you introduce your family for the first time, the outgoing president. And my dad said, oh, and there's, my wife and there's my son. And I'm like, this is an auditorium of like, it's like the size of like 4 movie theaters, these big rooms with all these people. And everybody turned around to look. And my dad said, oh, and my son's a medical student. And he was actually the first medical student to become a member of the American Society of Anesthesiology. They didn't have a medical student membership yet. And my dad made one. And so I joined up and everybody stood up and they clapped. And then my dad said, and he's going into psychiatry. And the room went freaking silent, awkward as hell. I've had nightmares, you guys. One of you grow up, become a psychiatrist, do therapy so I can go see you. because I got to get this, I got to get through this, you know? So the next anesthesiologist that took over as the president was this amazing guy. And I wish I knew his name. And I do want to meet him at some point in my life and tell him how much this meant to me and how this was an incredible thing. He came from New York City. He had his partner with him, really classy guy, lived in Manhattan, worldly, you know, and he took the microphone, and before he said anything, he said, "Hey, where's MacKenzie's kid?" And the entire room turns and they look back again. And I'm like, "Hi." He goes, "I want you to know, my psychiatrist is really good to me." And it was so awesome, man. Psychiatrists are loved by everybody. Other professions make fun of us until they're seeing us. When you go to the elevator as a psychiatry resident, all the other people, they kind of joke and they tease, "Look out. Oh, if we get stuck in the elevator, at least we'll have Jim." Like everybody jokes around until they're not joking, right? So don't let other medical students, family members, your neighbor, your mom's friend at the store, people are going to hear what you're interested in, and haters are going to hate so bad until they want to see you as their patients, right? That's because of stigma. The stigma of mental health is worse than it's ever been before, you guys. And if given a chance, the world will make all of our patients go away. That's why we have to protect our patients who are in incredible amount of pain by standing up and blocking laws and making new laws. You know this as well as I know this. Legislators like to hear it from young people and like to hear your story of why would you run a marathon to become a physician, to become a psychiatrist, to do therapy that you could take a 12-month online course to do, you know, in a different way. Why would you deliver babies? Why do you want to learn about AFib? Why do you want to learn about lithium? Why do you want to learn about all these different things, right? And let me go back to lithium for a second. Lithium affects the thyroid. Lithium affects the kidneys. Lithium affects babies, right? Epstein. Think what lithium's a perfect example. Lithium causes tremors. People with lithium see their dermatologist. Being a psychiatrist it transects every single field of medicine you possibly could have. When I graduated and I went to Loyola to start my residency, like this was a true story. It's kind of embarrassing, and I have to be careful because we're being recorded, right? So there had been a mom that gave birth to a huge number of kids, and it set the record of how many kids at once. You know, I can't remember. This was in the year 2001. And a few weeks later, that mom was on the news because she jumped into Navy Pier and killed herself with postpartum depression. And the same person had been heralded as this amazing victory of science that we could do, you know, what do they call that? The type of the type of procedures where you can get multiple kids at once. I can't think of it right now, but it set the record. Thank you. Exactly. And then that same person then later took her life with postpartum depression. And then it didn't really get talked about that much. You know, a lot of major things happened afterwards, and suddenly I found myself doing a lot of psychiatry consults in the OB. You know, we were doing them routinely. Psychiatry transects everything that happens in medical care. People feel uncomfortable by mental health topics. Therefore, they feel uncomfortable around psychiatrists. I would love it if all of you really gave it a lot of thought to be a psychiatrist, because I don't regret it at all. But the stigma that I've faced even from other doctors is there. It's real. It's giggles. It's little teasing. I can't claim that I've ever felt in any way discriminated, you know, nothing, but I know what the word microaggression means. Like, I get it. You know what I mean? If there's a case conference and everybody's talking about an autoimmune encephalopathy and the antibodies are doing this, that, or the other, and there's psychosis, I'll go in and I can stop it. But maybe I won't be invited to the talk afterwards where they talked about where the antibody came from, the pheochromocytoma. You know what I mean? That kind of stuff. psychiatry freaks people out, so they don't really know what to do with us. So we should be them. That's why I'm saying be a psychiatrist. Something that took me 20 years to realize, my friends, I didn't think of this 20 years since I graduated medical school until I've, in this past year, had this rise to the level of consciousness to be able to say these words. Do you know, since you guys are med students, this is perfect. So you're fresh in the books. So tell me if I'm wrong. And I mean this as friends and colleagues. This isn't like some trick. I mean, I want your brains for a second. I recently said, because I'm teaching primary care doctors right now how to do psychiatry because of that law that passed. So I was trying to get the pediatricians and family medicines doctors to feel comfortable with psychiatry. And I said to them, if you feel uncomfortable with psychiatry, and I'm also talking to you as medical students that might be having a internal debate with yourself whether or not to do it. If you feel uncomfortable by psychiatry, is it not because we are the only field in medicine? This is what I want you to call me on bullshit if I'm wrong on this. Are we not the only field in medicine that has no cures? Because I can't think of any. And I go one step farther. The reason I think psychiatry is the only field in medicine that has no cures is because we're the only field of medicine that has no known etiologies. We have theories. We don't have an absolute etiology. A medical student said to me once, but what about serotonin? And I said, what about it? They said, you kick up serotonin, people are less depressed, right? I said, yeah, but they started out the same level serotonin as me. That wasn't the cure. People aren't depressed because they have low serotonin. We've just learned that if you increase serotonin, they're less depressed, but they weren't low serotonin to start with, right? Something with the dopamine hypothesis is probably true, right? Too much, you're hallucinating, too low, Parkinson's, but we're not curing either schizophrenia or Parkinson's, are we? So it's more than that. So this is something that took me 20 years to be able to say, and I didn't say this last year, I've thought about this the last 6 months. Psychiatry is different than any other field because we're driving on the highway at speed with our headlights out a little bit. We're comfortable treating symptoms that we don't know where they're coming from. Our friends, the neurologists, they're like our brilliant cousins. We get the same diploma, by the way, American Board of Psychiatry and Neurology. They're like our brilliant cousins, but they're kind of nerdy, and I like to tease them because we can treat the exact same thing, but they need to know the exact receptor and exactly what's causing it and how to treat it. So you can have someone with severe psychosis on a Monday. We don't know what's causing it. I'm treating him. On Tuesday, we find out, oh, he's got an antibody that's hitting that NMDA receptor. Oh, okay. Send that patient to rheumatology. And I'm like, wait a minute. These still have the exact same level of psychosis. Yeah, but the rheumatologists are okay with it as long as they know where it's coming from. It's not weird anymore, right? That's psychiatry, guys. And if you think about it, every single thing that happens emotionally, behaviorally, has some kind of a very, very detailed, specific molecular level etiology. We just haven't found it yet. So 100 years from now, or hell, 10 years from now, when they know exactly what causes autism, and they look back on me with my ridiculous treatments, they're going to say, didn't you know all you had to do was bop, bop, bop? And I'm going to say, no. Because when I treat kids with autism now, I'm aware this isn't an emotional problem. 1/3 of these kids have seizures. Like, come on, that doesn't happen from people that have developed phobias. You know what I mean? A third of them have some kind of a medical problem. There's something that's going on here that's neurologic or endocrine based. I don't know what it is. There's lots of theories, but I guarantee you in our lifetimes, certainly in yours is, I don't even know what you guys will be doing. Autism is going to be peeled out of psychiatry in a hot second, the minute they know what's causing that. Perfect example, right? Hey, did you guys in med school learn about AIP, acute intermittent porphyria? Do you remember learning about that? You know what those people, you know what those people used to, you know who took care of them before they knew about the porphyrin rings and all that? You know who treated those people? Psychiatrists. because of the weird behaviors that would go with AIP before they knew what it was. Then one day somebody underneath the microscope said, hey, look at Mr. Smith's blood cells. Hey, well, why is he seeing a psychiatrist? Well, because we didn't know it was causing it. So in a way, psychiatrists were very much internal medicine, pediatricians, family medicine, because our what we treat, etiologies evolve, right? Don't doubt yourselves. If people say to you, why would you want to be a psychiatrist? You don't have to know anything. My first response when people tell me that is, well, if I get paid the same as an internal medicine doctor and I don't have to know anything, who's the joke on? You know, because it's not true. But to somebody that says that, that's a great response, because if you wanted, I don't do this, but if you wanted, especially if you were a child psychiatrist, you can charge whatever the hell you want. There's people that make $500,000 a year doing that. You know, I don't, and I don't choose to do it, but some people do, right? So if you can make $500,000 a year and you don't have to know anything, that's like, is that an insult? So don't listen to anybody that says that to you. By the way, talking about salary is extremely tacky. And I'm aware of that. And I want you to know, I help out a nonprofit, so I'm not that person. But I mention that because I've heard from pediatricians tell medical students don't go into psychiatry because you make, you know, 50 grand a year. I mean, that's simply not true. Don't listen to that, because that could scare a medical student who might have, you know, 300 grand in the hole. Listen, you can work for a nonprofit one day a week and make 6 figures. A nonprofit where everybody's on public aid, and you'll make 1 day a week, 8 hours, you'll make 6 figures. Nonprofit. So do not listen to anybody that ever tells you that you're going to live in squalor and you're never going to pay off your med school. That is the dumbest thing I've ever heard. That person just doesn't know. But it's like anything else. You know, you can be an attorney and make $15,000 a year if you don't work, right? Or you can be an attorney and make millions. And it's not about money for us at all. But I only bring it up in the off chance one of you has ever been fed incorrect information. So anyhow, and I'm watching the clock, and I'll shut up here in a minute, but I really want you all to know that where you're sitting right now, you've got the power to make laws, to change laws, to work on very, very important issues. In mental health right now, we've known for years that there's racial disparities. We've known that for years. I felt it for years when I used to work in the ER. I have a huge children's hospital across the street from me. If you're African American and you talk back to your teacher, you're probably going to be called bipolar. If you're a white kid from a northern suburb and you talk back to your teacher, well, I'm not going to meet you. I'm never going to meet you, you know. Now, I will meet you because you parked your dad's Porsche where the Range Rover goes, and those families explode, and they want a psychiatrist to say, psychiatry is just, it's unbelievable how emotions get ramped up based on different stuff. But minorities get incorrectly diagnosed with some major problems, and you need to be really well trained to be able to explain back, no, this kid does not have that. This is a topic for another time, but if you look at the diagnostic trends of bipolar, what happened and how it blew up, you know, 100-fold in a certain period of time that matches when antipsychotics were FDA approved for bipolar disorder, and what happened to which races it's shameful. I lived through that and I saw it happen. The good news is when people turned 18 and became adults, they magically no longer had bipolar disorder anymore, which is really weird, right? So I could use some help if anybody has interest in working on racial disparity issues as well, because that's a major problem. Now, I'll be on a phone call, though, with a school principal, guidance office, a therapist, parents, you know, attorneys, special ed department, and I'll be the only physician on the call, and I will be yelled at by 9 other people about why somebody has bipolar and why they want medicine. And I find myself all the time saying, well, hey, listen, I'm just a board certified child psychiatrist. I say that out of sarcasm, and they don't even get it. They're just like they don't even get that I'm making fun of them, you know. But it's real, guys. So anyhow, hey, you want to know my secret, and then I'll shut up. My secret for getting involved in you know, kind of medical policy making is you go to birthday parties for legislators. You go to walks. If somebody has a rally, everybody who's elected in your state has to have at least one or two events every year where they need $100 from each person. And that's how they pay for their yard signs and stuff like that, right? Now, you don't have $100 and neither do I, but you still go, maybe you get a couple people together. You don't have to pay the exact amount it says on those tickets. If it says host $2,000, supporter is $100, write them a check for $25. You walk in, you write it, you put down, you put your name tag on, you go shake hands. And you go to every single one of those. You pick one or two legislators. And I did that for 3 or 4 years. And I got to the point where their names are on my cell phones now. And they call me for help when they have issues that are on the news. And I help them. And I'm willing to go volunteer to help with issues for legislators that I don't need anything from in return, because someday I will, right? So one of my really, really close friends is our state treasurer, who used to be a senator. He's one of my only single friends. So, by the way, when you get older, if you're still single, it sucks, man. Because like all your you end up on the no-fly list with your friends' families. But so one of my good friends who happens to be single is our state treasurer. So we'll get dinner and stuff. One day, he used to be a state senator. This is my last story. I said, Mike, what's it like when you're an elected official and somebody asks you to vote on an issue in medicine when you're a senator? And you're not a doctor, so how do you know? And he put down his burger and he looked at me and he said, okay, Jim, I'm going to ask you a question and you're going to tell me the answer in 5 seconds or less, because then you had to make a vote. I'm going to give you an example. I go, you're ready. And he goes, ready? Is the ankle part of the foot or the leg? Go. And I said, it's part of the leg. And he said, well, that's what physicians say. Podiatrists say it's part of the foot. I go, why do you have that example? He said, one day I was asked to vote, who does the ankle belong to, podiatrists or orthopedic surgeons? And I know nothing of human anatomy. That was an example. And the next bill that he had to vote on was who should be able to decide where windows go in a building, interior decorators that are licensed or architects. He said, first he had to vote on the ankle and then he had to vote on windows. And he said, I don't know anything about either one of those, yet I held all the power. If a medical student knew Mike, he would have called you and said, quick, is the ankle part of the foot or the leg? Because they're being asked to vote on this stuff all the time, and nobody's there to talk to them about it. So I've learned to become friends with lobbyists also, and they're not as bad as you think. They're not. There's bad everything in this world, but there's really good lobbyists. Lobbyists are professionals that know how to talk to legislators, and they know how to leave them alone also. So if you can become friends with a lobbyist or two, they're really nice people and they can help you make connections. So anyhow, I'll shut up and see if anybody has any questions. Or did I totally confuse you? Now you're all like, all right, I do not want to be a psychiatrist. Go back to the kid with the cast. I want to be an ER doc. Hey, I just noticed that question thing in the chat. I just noticed that now, you guys. I just noticed that. You're preaching to the choir. Classmates, physician leaders, his parents tend to be very chill. Yeah, right? Doctors too burned out, exhausted. That's so true. But if you get involved, Millie, get involved and it brings back strength. Jim, you're a nerd. You're my buddy, so you're stuck working with me, dude. Jim said he'd love to work on this stuff more. Rebecca, sorry to okay. It's a mechanical question about the recording of it. And okay, sorry. Yeah, well, that's cool. Anybody have something on your mind, or you're all welcome to reach out if you ever want to talk more. I care about you as humans as well. I don't care if you guys have my Gmail or my cell phone. I don't care. I'm very proud to work with medical students to mentor, to help, whatever you guys want to do. I was too scared to join. We didn't have a medical student psychiatry group in my little DO school. And I kind of, to this day, I feel bad that I didn't start one. I didn't know about this organization. You guys are really, really light years ahead of where I was. So, but thank you for doing this, you guys. I hope you're all doing okay in the pandemic and hang in there, keep grinding. This is going to get better. It really, really will get better. When I was a brand new intern at Loyola, about 60 days, 70 days in, 9/11 happened. And I was a brand new psychiatry resident working in the ER. And it was terrible. I mean, for a million reasons. My parents were flying that day, by the way, and they're fine. But there were so many reasons why that was such a miserable, terrible day for us and the country and everybody. But that's how every story I've ever given about being a psychiatrist, other than this one, that's how it always started. You, good men and women listening to me right now, your stories are going to start with, I was in the midst of medical school during 2020. And you're so close to it right now, that might not even feel like a thing. Trust me, as someone that lived through I was on call 912. Like, oh, good Lord, you guys. I spent most of that week in the burn unit. Let's leave it at that. You know, people were doing wild stuff, man. So, and it became kind of my like bookmark in my book of my life. Like I can mark where I was and all that stuff. So this has meaning. Don't look at this pandemic as like, woe is me. Boy, does my life suck. This is for a reason. There's something to this, you know. Mental health's coming out on the other side in a good way now that we're able to do telemedicine and stuff too. We've been working on that for 10 years here in Illinois. We could never get this through. And I think, what was it, like the second day of the pandemic? They're just like, yeah, you can go ahead. So we're worried it might not last though. We're worried that the legislators will listen to the insurance companies and say, you have to go back to the office again, which is silly. So I don't know why you're here right now, why you're doing it, but you do in your heart, and listen to that. And don't let that voice talk you out of it. If you feel like you're getting talked out of it by your own internal narrative, get a hold of me. I'll gang up on it with you, and we'll make sure you get through this, okay? Cool.
Thank you so much, Dr. MacKenzie. Does anyone have any questions or comments for Dr. MacKenzie?
Anybody want to cut my hair?
It has grown.
It's ridiculous.
With a lot of the speakers who I have known personally.
Yeah, yeah, it's grown.
Yeah, we're pulling our hair out.
I know a really cool Russian barber that works a couple blocks away, but he hasn't reopened his business yet. In what's that? They call that, isn't it guy code, wherever you can't cheat on your barber, like, because like you fear they're gonna know, like they're gonna oh, you got your haircut. I think it was a Seinfeld episode about that. It was actually on Blackish the other night too. They had the same thing. You can't cheat on your barber because they're gonna know. But like I look like a hippie. I mean, I look terrible right now, but you know. All right, guys.
All right.
Stay safe, everybody. Hey, is there a way to give folks my email just in case if they want it?
I have it in the conference room. I'm going to send it out again at the end of this, but yeah. So if anybody, reach out to me for any of the contact information from our speakers.
Exactly. Because I don't want you just to be psychiatrists. I want you to become child psychiatrists. because then you're an adult psychiatrist and a child psychiatrist. But Jim, I don't like kids. Big deal. Become a child psychiatrist and see adults. Your malpractice rates are lower. I get a discount. It's a true story. I get a discount on my malpractice because I'm a child psychiatrist. I pay less. Even when I see adults, I pay less. There's a million good reasons to get, it's only 1 extra year. It's a 2-year fellowship, but you can leave your adult training 1 year early if you want, and then you're an everything psychiatrist. General psychiatrists can also treat kids, by the way, so don't listen to me. Yeah. But I would like you to be a child psychiatrist.
Well, actually, I have a question. So back when I was rotating the ER, the psych patients that really interested me were the adolescent patients.
Yeah.
So I still want to know if I want to do like just regular psych, gen psych, or child and adult, because a lot of my mom's friends who are like child and adult, they only do adult. And versus my mom, she was only adult, so she has no opinion.
Yeah. My best friend is an adult psychiatrist that might go down to 14. In Chicago, I could just speak for my town. Being that there's 50 child psychiatrists in Chicago, I'm both, but I think there's 30 or 40 adult psychiatrists for every child psychiatrist. So just statistically, it kind of feels weird if I was to take on a new patient right now and I know there's 100 other ones in my neighborhood, but no other child psychiatrist. You know what I mean? So but see, I'm a child psychiatrist, so I call general psychiatrists adult psychiatrists. That's bullshit of me to do that. Adult psychiatrists are general psychiatrists. They can see babies if they want. Right. Mm-hmm. A general psychiatrist can it's like being a family medicine doctor. You can see grandma or a baby. You can, and they're licensed. It's not weird. I'm a nerd and did a 2-year second fellowship. you know, so that I feel a little more comfortable. But don't, my God, you guys, that's not a waste of time either. It's for the same line of thinking as why it's not a waste of time for you to learn how to deliver a baby. I use more adult general psychiatry in my daily life than I do my child for my patients, because the kids are not making their own appointments. A kid's behavior has to cross the threshold of an adult to get sent to me. And that person is usually really mad and in the midst of a divorce. And there's all kinds of emotions going on. The why now? Why are you here now? And you use your adult psychiatry brain, you know, because you have to have them come back. So I don't know if I answered your question right, but you can some general psychiatrists will see kids and some don't, but they can if they wish. You know, you can if they wish.
It looks like we have a question in the chat box, which is, do you have advice on getting informed and keeping up to date on local political issues related to mental health while being a busy med student, resident, physician, etc.?
You know what the hardest for me right now is, every once in a while, psychiatry and mental health becomes vogue, but it becomes superficially vogue. And it's superficially vogue right now, where everybody's talking about it, but nobody's really doing anything. You know what I mean? So I'm saturated with messaging from all these different groups about how important mental health care is. And it's getting actually harder now to find who. It's like all the TV commercials right now that say now more than ever. You're like, really? Or like, really, Dunkin' Donuts, you care about me that much? Where's my freaking donut then? You know, it's like, you don't care about me. You're just, everybody's using these corporate things. So it's funny. I'm actually having a harder time now connecting for mental health, because everybody and their mom right now is suddenly interested in mental health. But if you crack through the surface, they're not really doing anything. So to answer your question, American Psychiatric Association, I like their blasts that they send out. The American Academy of Child and Adolescent Psychiatry, I like their blasts. Obviously, you guys are members of the APA or you wouldn't be here. ACAP has the same thing. That's the child psychiatry. And, you know, pick one or two groups. I've made a mistake in my life where I tried to belong to too many things and I just get burned out and it's just too much, you know. And I think this year I'm going to maybe try to reduce all my memberships to just a couple things. But pick a couple, sign up, and then you'll see the mental health stuff. Here, I challenge you, medical students, write them back. Say you're a medical student. Don't be shy. Own it. Hey, and if any of you are around Chicago when this reopens, or if I get back to Minnesota sometime, we'll go to an event. I'll bring you with me and I'll introduce you, and you will see what happens if you go to your state medical society meeting and you say, I'm a medical student, because your heart says, I'm just a medical student. But that's not what happens in those rooms. What happens in the rooms is they say, holy shit, we have a medical student. Like, you really want to own your position right now and as the future. Don't let 75-year-old, you know, men dictate your career right now, you know. So get involved, you guys. It might seem a little bit scary, but it's not, you know. And if you're around me, I'll take you to stuff, you know.
I'll kind of make a point off that just as we're wrapping up. It was actually after I heard you speak for the second time that I just got one of the blasts from the Michigan State Medical Society. I'm from Michigan. And asking for people to sign up for one of their task force. And one was actually on the collaboration of behavioral health and primary care, like this task initiative of trying to get it active in Michigan. And I was like, oh, sure, why not? I'll sign up. I probably won't get picked, like, considering.
Listen, that's what I spent the last 3 years of my life doing.
Yeah.
And I made the law here. Will you connect me to them? Because I was born in Michigan, and I will help. I'd be very happy to help Michigan do this, you know?
Yeah. No, I probably should have asked you first, but I did give your contact information already.
Oh, good. Well, because I'm doing it with kids too. It's even weirder. Yeah.
Sorry.
No, it's cool. It's all good. That's a perfect example of how in mental health, though, things get tossed around. Everybody talks about integrative care right now. That's like a hot corporate word. Oh, we're holistic. That was an old word. Where everybody's holistic. Now everybody's integrative and collaborative. But if you really look into it, they're not really, you know. And maybe places are doing integrative care. So they'll put the psychiatrist inside the primary care clinic You're like, yeah, but what good does that do? Because you still make me go see the patient and close the door. It doesn't speed up the rate limiting step for access of care. It's still how fast can I go? You know, it's corporate, it's marketing, some of this stuff, you know, so don't be dissuaded. You know, find what you want to do and just dig in and make it happen, because what you want to do exists at some level. You might just have to make it, you know, so don't put up with any models that you don't like, that just feel broken, that don't seem to work. Fix it. You have to make a law usually, and I'd help you. We can do it. It's kind of fun. It's terrifying, but kind of fun, you know.
Well said. Any last minute questions?
Bye, guys. Good luck.
Hi, thank you, Dr. MacKenzie.
Come to Chicago when the pandemic's done. We'll go for a walk. See you. Hey, again, I'm really proud of you guys. Thank you for doing this. This is so cool. You could have been watching Netflix right now, or maybe you are. I can't. You're watching. See you guys.
Thanks.
Bye.